Yeah, hello. Thank you for following Nursing Hub. And of course, my name is Andrew. Today we are going to talk about, of course, introduction, anatomy, and physiology as part of our lecture series of anatomy and physiology, trying to introduce ourselves to the concept to ensure that we dive into it onto a great extent. So today we are going to be much about the core vocabulary, of course, and directional terms within the anatomy and physiology perspective. Of course, what you need to remember, what you need to understand or point out is that the anatomy and physiology is one of the biomedical courses which make the foundation of nursing and midwifery, but also other health professional courses. So it teaches us two most important aspects, and that is about what life means or how life processes happen in order to bring out what we call homeostasis or what we call normal internal environment. So it is very, very important to look at that, and of course, very important to analyze how it is very important for us as nurses and midwives to learn about anatomy and physiology. So the introduction, we're saying welcome to your foundation lecture on anatomical language. And of course, in medicine and biology, we have casual terms like above, below, front, or back. They are mostly problematic to beginners into the anatomy and physiology arena. However, it is very important that if a patient is lying down or above, their head could mean, their heart could mean their chest or their head, depending on how you look at them. So it is very important to know that to avoid dangerous misunderstandings, we use a universally standardized set of terms which we are going to be learning or you are going to be introduced to. Next is that let's look at the standard baseline or what we call anatomical position. The thing before applying any directional term, you must always visualize their body in the anatomical position, and this serves as our unchanging point of reference. Because the word anatomical position means that for you, from the standpoint of you as a nurse or midwife, how you view the patient you're going to work on, we want them to be in what we call anatomical position, and we are going to be discussing that into the next points. So even if a patient is curled up on their side, made as if they are standing in exact posture. Number one, we are saying the body. When we say the body, meaning standing upright, facing straight ahead. That is when we say the body. Feet, we're saying they are supposed to be flat on the floor, parallel, and pointing forward. Of course, there are some people when they are standing, you may find the feet are maybe facing sideways, but in anatomical position, we want them to, their feet be pointing forward. Arms, they are supposed to be hanging down at the sides of the body, not swinging, not waving them, but hanging down at the sides. Palms, of course, they should be facing forward, and the anatomical position, we call it in the supinate position or supination, with the thumbs pointing away from the body. Then we have what we call the crucial rule, and this means that the left and right always refer to the patient's left and right, never your own perspective as the observer. In short, what we are trying to mean that when you say the right side or the left side, it should not be according to you, the observer. It should be according to the patient that you are observing. Okay. So number two is about the anatomical directional terms, and in this case, we are going to look at the terms which are almost always paired as opposite. They describe where one body structure is located in relation to the other. And in this case, we are starting with this diagram. One is showing us the body planes, and another one is looking at the body planes plus the section. So the body planes, literally, they are divided into four. We have what we call the coronal plane, which give us the right and left perspectives. Then we have the sagittal plane. If you can see, the sagittal plane is giving us the posterior and anterior. Then we have the transverse plane, which is giving us the superior, or what we call the proximal and distal, or superior and inferior. And then, of course, as you can see, we have what we call the coronal plane, which can give us literally maybe medial and lateral. However, of course, from the median sagittal plane, you can get the lateral and medial, and then from the transverse plane, you can get posterior and anterior, and then, of course, as you look at the coronal plane, you can get inferior as well as superior. But we are going to dive into this, into the depths of the matter. So superior and inferior versus inferior, that is from the vertical axis. Superior, or what we call the cranial or cephalic. Cephalic in most other things may literally mean the head. So we're saying towards the head or upper part of the structure, or maybe some say above. Example, the forehead is superior to the nose. If you look at the forehead, then the forehead is on top of or is above the nose, and that's what we call superior. Inferior or caudal, which may literally mean the tail, away from the head or towards the lower part of the structure, or someone meaning below. So example, the navel is inferior to the chin. Or for example, someone may say the neck is inferior to the chin, meaning that the neck is below the chin, or someone may say that the nose is inferior to the eyes, meaning that you have the eyes on top, then the nose is below. So meaning that superior may mean above, and then inferior may mean below. But let's look at this diagram, and we can extend or expand it further. So anatomical directions, as they may sound, you can look at this diagram and see. When we speak of the word interior, then we are meaning literally above, and when we speak of superior, inferior, below, and then superior, we are meaning above. So meaning that as you look at that diagram, it is very, very important to appreciate the meaning of the word is the language as it may sound. Okay, so having said that, we can move on to the next slide. Of course, here you can see superior is here, then inferior here. Then you have lateral away from the body, and then medial is towards the midline. The midline may be here, lateral is far away, medial is towards the medial. Then you can have posterior, like at the back, anterior in the front perspective. Proximal, top, distal, going downwards. Courtesy of the hairline, this picture was picked from that. We have to acknowledge the site where the diagram was got from. Okay, so the next is about anterior versus posterior, or what we may say front versus back. When we say anterior, in this case, we are meaning that it is the ventral or towards or at the front of the body, in front of, that is, for example, so you can say the breastbone, or what we know the sternum. This is the bone where the ribs are joined to, plus the clavicle bone, or what we call the butey bone, is in the anterior perspective of the sternum. So what does that one mean? It means that when you look at the case of the sternum, it is in front, and then it means that the supine, or what some people may look at the vertebral column for that case, as the bones that house or protect the spine the ones which are protecting the spine. They are the ones which are at the back, and then the sternum is in front. Having said that, we can move on to the next item. The posterior, which may mean the dorsal, and they're saying towards or at the back of the body. And it is very important to look at it also may mean something that is behind. And when we say that, of course, it may mean that it is very, very important for us to acknowledge that being meaning that we have a part that is in front, then we have a part that is behind. Meaning that in this case, anterior means front, and then posterior means back. A case in point is this diagram, which we may have here. May have the one looking at the front, and then may have the other one looking at the back. So it is very important to note that and appreciate what may be the meaning of when you say anterior, and meaning front, and then posterior meaning the back. Okay, so the next is about the medial versus lateral in relation to the midline. In this case, it is very, very important to note that when we say medial versus lateral, it is of good interpretation that the word medial means midline, or towards or at the midline of the body or the inner side. Example is that the heart is medial to the lungs, meaning that when you look at the heart in the mediastinal perspective or mediastinal cavity, within the thoracic cavity, we have the portion called mediastinum, where the heart is located, encircled by the lungs, the right and left, meaning that the heart is more to the midline as opposed to what we may call the lungs. Next is about the lateral, which will mean away from the midline of the body on the outer side. For example, the arms are lateral to the chest, meaning that when you look at the arms, they tend to be to the outside perspective compared to the chest. So note that the intermediate means between a more lateral structure, e.g. that this collarbone is intermediate between the breastbone and the shoulder. So in short, when we are looking at the word medial, we look at towards the midline and then lateral far away from the midline. Okay, so that is the illustration that can help us to understand further what I was trying to. When you look at this illustration, you can easily tell that the word medial, we are meaning that imaginary vertical line down the middle of the body, meaning that midline may reflect middle. And now let's say medial, that means towards the midline or middle of the body. As you can see, medial, midline, or middle. And then lateral will reflect far away from the midline. Okay, so next is about what we may talk about as proximal versus distal, and these are used exclusively for limbs. So these terms describe the positions along the arms and the legs relative to where the limbs attaches to the torso or the trunk. Meaning that proximal is closer to the, when someone says proximal is meaning, is trying to mean closer to the origin of the body part or the point of attachment of the limb. A good example is that the elbow is proximal to the wrist, meaning that in this case, the elbow is closer to the shoulder joint than the wrist. What does it mean? Meaning that the wrist is at the end or towards the end compared to the elbow, which is closer to the shoulder. So we have something, someone can say top and bottom, and then proximal, which may literally mean that we are looking near to the top. Distal, further from the origin of the body part or the point of attachment of the limb. A good example is that the fingers are distal to the wrist. And this is very, very important to note, because if we are talking about being top or bottom, we are saying proximal may reflect something close to the top, and then distal something that is towards the bottom. Okay, so we can give an example, and a good example is going to be this illustration that we have put, and we're saying proximal and distal. If you look at the arrows, the ones in red, they are looking at the proximal, and we're saying, for example, the ankle is proximal to the foot. The ankle joint, we have this first star here, may literally be meaning that we are looking at being close, being on top, like the ankle is on top of the foot. And then the knee joint, or the knee, is proximal to the ankle. So the knee, you can see, is on top of the knee as we move ahead. And then the hip is proximal to the knee. So the hip joint is on top, or is at the top end as we move from the knee. Then when we look at the distal, then we are doing the opposite. That the knee is distal to the hip joint, and then the ankle is distal to the knee, and then the foot is distal to the ankle in that same perspective. So the next is about superficial versus deep, and in this case we are talking about relation to the surface. So as we look at the surface, we are saying superficial. Someone may say we are meaning external perspective, and then deep we are meaning internal perspective. So let's say towards or at the body surface, for example, the skin is superficial to the skeletal muscles. It may mean the skin is the outer covering of the skeletal muscles. At the end of the day, you find that the skin is the one that is covering the skeletal muscles. Now, the skeletal muscles, then they are internal, and then the skin is external. Next is about the word deep. Deep may mean internal, and we're saying away from the body surface. And we're saying more internal, meaning that, for example, the lungs are deep to the skin. Or someone may say the skeletal muscles are deep to the skin. Meaning that in this case, we may say that the depths of the matter, meaning that when we say deep or superficial, superficial outer, and then deep, meaning internal perspective. Okay, so when you look at the next term, we're saying in this case we can look at the relation of these terms, that when we say superficial, for example, here we're saying towards or at the body surface, we can look at the skin being on top or superficial, and deep away from the body surface, meaning more internal. Those are like the bones, the muscles, blood vessels, and other items. So next is about quick reference summary table, which we can use for whatever we have so far covered. And we are saying in our quick reference, in this case, we have the term superior, which opposite term is inferior, meaning higher or stroke towards the head. Those are examples. And then inferior, we're saying superior is the opposite term, and we're saying lower or towards the feet. Anterior, which opposite term is posterior, and in this case we are saying front side. Then posterior, which opposite term is anterior, we are saying at the back side. Then other quick reference summary table, we have medial, opposite term is lateral, and we're saying this is closer to the center line. Lateral, opposite term is medial, and we're saying further from the center or midline. Then proximal, we are saying opposite term is distal, we're saying closer to the limb root. And then superficial or stroke deep, we're saying closer to the surface. And then deep, opposite term is superficial, we're saying hidden, far indoors. And I give an example of like bone tissue. is deeper to the muscle tissue. Then we can look at other related terms like the body planes and sections, like I earlier told you. We're saying to observe the internal structures, the anatomists use hypothetical flat surfaces called planes to slice through the body, and the resulting view is called section. So sagittal plane slices the body vertically into left and right portions. If it runs perfectly down the middle, it is a mid-sagittal or median plane. If it is off the center, then it is parasagittal plane. And the same frontal bracket coronal plane slices the body into vertically into anterior front or posterior back portions. And of course, remember what we talked about, the anterior being front and then the back, posterior being the back. Then we have another one called transverse or axial horizontal plane slices the body horizontally into superior, on top, and inferior, which is the bottom portion. And this is the perspective commonly seen, most especially for those who look at CT scans. Okay, so next is about this final slide, which talks about the body planes. You can see the coronal or frontal plane. Then you can look at the axial or horizontal plane, or which you may call transverse, which cuts the body into superior and inferior. Then you have the sagittal or longitudinal plane, as you can see, a median plane cutting it right and left, and then what we call the parasagittal plane. So I want to say thank you for listening. I hope this is a brief introduction to our first lecture series of anatomy and physiology. And I want to appreciate you for listening and giving in. I will be waiting for your comments in the text box to see what you make of this presentation. Big ups to everyone. Comment put your comments in the comment section, and then we shall be good to go. Thank you so much for listening. Follow Nursing Hub, subscribe for more updates and more information.